So fibroadenoma is well structured, it tends to be a little hard to touch, but is a lumpy structure nonetheless. Now the flip side of a fibroadenoma is actually a cyst. A cyst tends to be a soft capsule.
Sonali, I'm so sorry.
No
whenever you're showing a demonstration, is it possible for you to sort of unshare the screen? Because a lot of people are they're not able to actually see the demonstration.
Sure. Okay. We'll do. No problem. We'll do.
Thank you.
So the opposite of fibroadenomas are actually cysts. So like I said, when a fibroadenoma is fairly rock hard and big, a cyst tends to be very squishy and actually filled with fluid. So fibroadenoma is a much more solid structure. A cyst is a slightly more liquid structure. Cysts can form for several reasons. It could be that it might have been an infection that led to a cyst. It could be an irritation that could have led to a cyst. But cysts are actually painful. So the difference is many women come up and say, hey, listen, I think I have a slightly lumpy structure and it's painful to touch. So normally those tend to be cysts. But fibroadenomas kind of stay on their own quietly in the background without, causing much harm. So again, if you have a painful condition, please go and meet your gynaec. This is not something that you should self-diagnose, and it is not something that you need to suffer in silence for, right? So please remember, whether it is breast pain, fibroadenoma, cyst, you should go and get yourself checked up once a year at least with a gynecologist that you trust, and make sure that you have these open discussions with them. Now, while we talked about some conditions which fundamentally are seen mostly in women, gynecomastia is a condition that we see only in men, right? So you do not expect men to develop breast-like structures or breast-like tissue in the pectoral area. But gynecomastia can happen. Gynecomastia can happen sometimes with age, when the estrogen production in the men tends to increase. Right? Sometimes the testosterone, which fundamentally plays a big role in male hormones, tends to be a little subdued, and estrogen sometimes can take on, and therefore gynecomastia could be a condition that might develop. Now, it doesn't have to be painful, right? Sometimes it's just a condition that is there, but if it starts getting difficult for you, it starts becoming uncomfortable for you, then here again, for all the gentlemen, please you can go see your general physician. And it's a very simple procedure. If you want to get a reduction done, there's a gynecomastia reduction also that happens. It's a fairly simple plastic surgery procedure, and that amount of excess tissue that was developed can be removed as well. Right? So it's not a condition, again, for everybody that you need to go through or, have undiagnosed. So please have that discussion very openly with your GPs, with your gynacs. So again, hint to everybody, please make sure if you don't have one, get yourself a good gynecologist, get yourself a good urologist, and make sure you start seeing them at least once a year if possible, right? And of course, we would not be able to get through this slide without talking about the mother of all things, i.e. breast cancer, right? There was a time when we used to feel bad about someone having breast cancer and never worried about it. It was just a condition that other people got. But very sadly, we are at that stage where everybody knows someone who might have been suffering from breast cancer. So again, like I said, the purpose is to educate you on what it really is, hopefully demystify it and give you a chance to really take part. So I will be spending some time on breast cancer specifically, so I'm going to move on from this slide so that we can have a much more healthier discussion. All right. I do want to talk a little bit, like I said, before I move on to what all you can do in terms of breast cancer, purely because it is Breast Cancer Awareness Month. Listen, do me a favor, don't freak out on this slide and be with me on this. But I think it's also important that you understand the facts of the matter. The fact that of the deaths that happen in cancer, 1 in every 10 deaths happens in urban India. I'm not even talking about the rural India deaths, but I'm actually talking about urban India deaths. Things are a little tricky for us women. 1 in 8 women are suspected to suffer from breast cancer throughout their lifetime. Now, look, the good thing about statistics is that it's an average. So it tends to be higher in the developed countries, but for India, the number is a little lower. But having said that, it is a little bit of an awakener nonetheless, saying, hey, listen, we've got to sit up and take notice. It's not something that we should continue to ignore. The difficult part of this is the fact that about 70% of the cancer deaths that we have are actually in a very prime productive age. It's the 30 to 69 sort of age. This is not the time when you are actually thinking about these conditions. You're vibrant, you're alive, you're working, you're doing stuff. But it is unfortunate that in India we do see this number. And very sadly, in India we do detect some of these conditions quite late. And the reason for detecting it late is not that we are not aware, but I think we do tend as a society to ignore some of these conditions until it becomes a little, very advanced. But it is very important to know that 1 in 3 cancers is preventable, and very luckily breast cancer is one of them. If caught early, 90% of your breast cancers can be curable right at early stage, right? So here again, catch it early. Make sure you reduce your risk to get this thing in the first place. And if you do, make sure that, you detect it early as well. And that's the fundamental thing I want you all to take away from this session. So very simply, I won't mull too much over this. What is cancer? It's just an uncontrolled growth of cells, ladies and gentlemen. There is nothing else to it. A tumor might sound like a very scary word, but it's just a lump of cells together. A tumor per se doesn't have to be cancer. A tumor could be cancerous or non-cancerous, but there are certain conditions that lead to the creation of the tumor, and that's what you need to understand more importantly. Cancer can be caused by things that we call avoidable factors, things which are in our control, and then again, unavoidable factors as well. I'm actually going to spend some time on talking about some of these factors before I talk to you about the signs and symptoms. So this particular slide is not just for breast cancer. While I've talked about it being one of the primary things you can do to reduce your risk of breast cancer, this is something that will be fundamentally useful for you to talk about reducing fibroadenomas, making sure that your breast health fundamentally is very, very important and paramount, right? So quick show of hands, how many of you actually exercise regularly? Not that you've taken a gym membership and never gone there for a month, but how many of you really go out and say that at least 2 times, maybe 3 times a week? Okay, let's be fair, 2 times a week. Okay, fantastic. You've got a very, very disciplined bunch of people out here. So yes, now look, no substitute for exercising regularly. Please make sure that you do exercise, right? Whatever form suits you. It doesn't have to be an expensive gym membership. You want to run. You want to go for a walk, go for a walk. You like yoga, by all means do yoga. If you like to play with your kids, because like me, you're a guilt-ridden mom who doesn't know what to do when you get home, go out and play with your children, but try and get that exercise in, right? We're talking about at least 15 minutes of rigorous exercise 3 times a week, or half an hour of moderate exercise at least 3 times a week. Whatever suits you, whatever floats your boat, do it, but make sure you get some exercise in. Now, I know everyone's been inundated with eating healthy, but let me just tell you, you can really simplify this. Just make sure you switch from refined to whole grain, please. I know a lot of you from where you stay, it's not a difficult choice to make, right? It might take a little time on the palate for you to go and switch, but that's not a bad choice, right? Move to eating healthy, start doing whole grain, try and get as much water in. For those that normally, had this been an interactive session, I would have asked you to tell me this, but when we talk about eating healthy, we are talking about getting 5 portions of fruit and veg into your daily diet. It's not that tough to do, right? Try and get a fruit in somewhere. You have 1 bowl of sabji for lunch, 1 bowl of sabji for dinner. Try and throw a little bit of salad. If you can skip that afternoon sandwich, mirchi bhaji, samosa for an apple or a banana, you would be doing yourself a great favor, right? So make sure you get your 5 portions of fruit and veg, a lot of water in, switch to whole grains, but more importantly, if you are also a meat eater, now this is the hardest. Look, I come from Hyderabad, so we love our biryanis over here. So if you come and talk about eating meat, you will have to switch from red meat to white meat. That is a small change you will have to make, and try and go lean as much as possible. I know the bone and the fat make it really tasty to eat, but still, right? So get lean as you can. So eating healthy and exercising regularly while we all talk about it to get control of your body weight, i.e. getting a BMI of between, see, an average BMI, ladies and gentlemen, should be between 22 and 23. I know we talk about 18.5 and 25, but do me a favor, after this session, all of you have access to the internet, just Google a BMI calculator and check, what your actual BMI is, right? So that's very, very important for you to get that in. Getting a healthy BMI of anywhere like 22, 23 is a perfect BMI for an Indian body shape. Try and get that in, but you won't get that unless you eat healthy and you exercise right. Now, the tricky one, right? For alcohol. Now, how many of you are social drinkers or love your glass of wine now and again? Right? I'm sure there will be a few. All right, thank you very much. There are a few who have told me that. Now, you have to remember this one aspect. Your body has a limit of processing alcohol, right? What does that mean? Your body can only consume, now if you're a female adult, we are talking about 2 units of alcohol. What does that mean? It means 10 ml of pure alcohol. So whatever beverage you like, whether it's wine, whether it's beer, whether it's your vodka, your gin, your rums, whatever you want, but make sure that your daily processing limit for women cannot be more than 2 units. So as you know, alcohol is in a pint of beer, whatever strength of alcohol you want to take, whatever beverage you like, figure out how much alcohol you actually have. Just turn it around, turn the bottle around, you'll have the details on the label, right? Find out what you can actually consume. For gentlemen, you guys are slightly luckier. It's 3 units per day. That's the maximum limit a male body can process. But both men and women, not more than 14 units a week, right? So please make sure you don't bust your daily limit. I know a lot of people say, listen, I'm very, very good. Monday to Friday, I do a fantastic job, but I've, 6 Patiala pegs or sundowners on Saturdays, perfectly fine. Unfortunately, the body doesn't work that way. You can't be good over 5 days and make sure you splurge on the weekend. Try and regulate it and moderate this as well. So even if you want to spread your drink over at least 3 sessions, ladies and gentlemen, spread your alcohol across 3 sessions at least. Do not consume more than your daily limit as much as possible. Now, when it comes to breast health and tobacco, I'm not going to ask this question because for me, tobacco smoking is a big no-no. And if you are a smoker, now is the time. It's never too late. Stop. You'll have to try and quit smoking. I know it is very hard. It is not easy, but you will not be doing yourselves any favors if you continue to smoke. All right. So the reason being that tobacco smoke itself has about 7,000 chemicals in them. Right? It's not one, it's not two, it's not just nicotine and tar and arsenic. It's not that simple. It has 7,000 chemicals, 70 of which are cancer causing. Now, if this is a choice and this is a controlled element, then my point would be, do you really want to subject your body to this risk? Right? So you will have to eat regularly, eat healthy, control your body weight, limit your alcohol, limit.
Adios, amigo. Powering off.
Sorry, was there a question? Okay, all right. I assume that the tobacco point would have raised a few eyebrows, but that's fine.
So Nali, there's one question in the chat actually. Around what do you mean by women can consume 2 units of alcohol? And do you mean it is completely safe if it's under 2 units?
So fundamentally, alcohol
You've plugged
is a
into
fatty
Nirvana.
drink, right? So
Your
it
device
depends on
is
the
ready to
body.
pair.
So it depends on the body's capacity of how much fat your body can actually burn. So female adult body does have the ability to burn at least about 20 ml of pure alcohol per day if you are healthy without any other condition, right? And this is when you are a healthy individual. So that is what you'll have to remember. But yes, limited form of alcohol is okay. But when it comes to tobacco, that's a no-no for us. And when it comes to 3 units for the men, can be 30 ml of pure alcohol. So let me give you an indication. If you have a glass of red wine, then that is approximately 2 units, right? A light strength beer that is 2 units. But if you go for a moderate or a heavy strength spear, now that's 3 units. So you've got to be careful about how much you consume and at what frequency you consume it as well. Right? And so quickly moving on, last but not least, being sun safe. It is very, very important that you put sunscreen on when you go out, not just because it is something that is, for those who are extremely skin conscious, but more importantly for your health. So an SPF 30 is a pretty good number to use for an Indian skin coloring, but please make sure you wear a sunscreen when you go out. Doing these things will not only reduce your risk of getting cancer, but also reduce your risk of getting fibroadenoma, cysts, making sure that you are in a much healthier form. Like I said, remember the breast does not have muscle, it only has fat. So every time you increase your consumption of fat, it goes and sits very nicely in the breast tissue. Right? So that is the one thing you have to remember. To really keep your breast healthy, you've got to get into a very healthy lifestyle. I'm conscious of the fact that we are quickly running out of time. So let me just step into what you need to do. So like I said, the first thing that I'd like you to think about is to make sure that you get yourself into a very healthy lifestyle. The second, you need to start looking for conditions. A fibroadenoma, a cyst.
Adios, amigo. Powering off.
Not come up and make themselves presentable. And you unfortunately have the hard task of going looking for them. So what is it that we suggest when we talk about breast health? One, if you are an individual 21 and above, but in fact for a lot of high school girls, a lot of women, young women in colleges, we suggest this as well, start getting into a monthly breast self-exam cycle, right? So what do we mean by that? You will have to do a quick breast exam. I will show you, I'll turn this off and I'll show you how we actually do a breast self-exam. But you will have to get into a session where you do a breast exam every month at the same time. If you have your periods, then it is on the 6th or 7th day of the period that you've actually got to start. So the day you bleed is day 1, and you got to start on the 7th day, because like I said, the hormones which fluctuate, estrogen and progesterone, need to be in balance. So you can't have a lumpy structure, you can't have a tender and painful breast. So you do need to touch, you need to examine, and you need to feel for lumps. But this is something you should undertake every month. For women who are already menopausal, please make sure you do this any given fixed day, right? The 1st of the month, the 15th, or the last day of the month, whatever suits you, whatever is convenient, but please try and make sure you do this monthly. Once a year, ladies and gentlemen. Are you all able to hear me?
Yes, Sonali, we can hear you.
Yeah, so sorry about that, Kusha. So as I was mentioning, ladies and gentlemen, we are talking about getting a mammogram done, right, once a year. Now, the mammogram has had a little bit of a bad name given to it, where people say, look, it's a difficult process, it's a difficult procedure, but that used to be a very long time ago. We've got fantastic digital mammograms coming in along with the analog ones. It's a simple low-dose X-ray. It's not exactly the X-ray, but it's a low-dose X-ray of the breast, which is taken in different formats, right? You have a vertical image, you've got a horizontal image. What that does is it helps the doctor put one image over the other to fundamentally understand what is happening with your breast. Now, many people ask, why don't we do mammo straight off? I'm a 25-year-old, why can't I get a mammo done? The reason is that your breast is still very dense, i.e. it's firm, yeah? It's a younger body. And when you take a mammography image for a dense breast, it will show up as white, right? And lumps also show up white. So if you do a mammogram when you are much younger, there's in fact no benefit for it. But once you're 40, right, that's when the mammos really start making a difference. So getting a mammogram done once every year, speaking to your gynec about it, having it checked out is very, very important. Now, while the top 3 that I talked about are particular processes, you do have some fantastic work happening in genetics, right? If women come and say, hey, listen, all of this is well and good. Every year you want me to go get a test, but can't you tell me conclusively if I could ever get a risk, am I at risk of getting breast cancer at all? Now, there is a way there are two genes, that is BRCA1 and BRCA2, that's breast cancer gene 1 and breast cancer gene 2. If there are mutations found in this gene, which you could do through genetic testing, you will actually be able to predict if you are at risk or not. Right? There are simpler ways. You can speak to geneticists as well to try and get this done. But the amount of advancement that technology has made is that you can predict if you're even in the risk bucket. Right? So doing your breast self-exam, annual clinical, if you're above 40, annual mammo, and once in a lifetime, if you feel like it, this is completely up to you. If you want to probe a little and be proactive if you are at risk, then yes, a BRCA1 and 2 testing also. To be complete, just to make sure your female health is taken care of, what we also suggest from a cancer perspective, get a pap smear at least once every 3 years, right? This is a vaginal smear or that we do near the cervix. Make sure you get a pap smear and make sure you do a stool test, which is called a fecal occult blood test. So pap smears will take care of cervical cancer for you, and fecal occult blood tests take care of colorectal cancers as well. So there are only a few tests that you really need to do, but if you can get into a habit of doing these annually, if you can get into a rhythm where you start talking about these and start having discussions with your doctors, you will realize that this is a much healthier way for you to actually take charge of your body, right? This might sound a little technical today, but believe you me, the first time you go do your tests, it will feel a little awkward. But as you get into the rhythm, you'll start understanding your body better. I think it's better to know what we are and what we do, rather than just assuming and hoping and, staying fingers crossed and saying, listen, I just hope nothing bad happens to me. I think we're all smart, educated individuals, and in this day and age, it is very important that we take charge of whatever we are going through, right? So, what I would like to do, and Kusha, maybe, do you want me to turn the slide off just to do a quick breast self-exam demo or a session, or how do you want me to? I can do it as part of the Q&A as well.
Actually, why don't we do this? Why don't you show the demonstration for breast self-exam and then have the Q&A?
Done. Let's do that. So I'm just going to go and turn.
Sonali, before you move this, there was a question that we missed out because of the clip. Someone has a question around, them having a family history of breast cancer. How much does that put them at risk? If you could address that.
Sure. So a family history of breast cancer. So when you talk about this, there are actually two cancers that we need to talk about. We need to talk about breast and ovarian, because the risk comes from both the cancers, right? So what do we mean when you say you have a family history of breast cancer? You need to identify how this individual is actually related to you genetically. So if it is a first degree relative, what that means is if it's your mother, if it is your sister, or your daughter. Now that's a first degree relative, right? One degree of difference. When we talk about second degree, you mean your aunt, your cousins, or your nieces, right? So that's the sector. If you have one first degree relative who has had breast or ovarian cancer, then yes, unfortunately, you are in the risk bucket. But let me be very clear, that doesn't mean you're going to get breast cancer or ovarian cancer, right? What that means is you are in the risk bucket. It means you've got to be a little more proactive and going to try and find that a little early. That means what others are going to do, you need to do about, 4 or 5 years earlier. So meet your gynec early. You can't, if you're less than 40, you can't yet do mammos, but we can do ultrasounds for the breast. Right? So there are options. So when we talk about a risk, first, how is that individual connected to you? If it is one first degree relative or two second degree relatives who might have breast or ovarian cancer, then there is a slight risk of it. So what you actually need to do is you need to speak to what we call a genetic counselor. The genetic counselor will do a pedigree for you, i.e. analyze your mother's side of the family, your father's side of the family, and actually talk about what risks you might have. So the pedigree is a very simple conversation. It's a 1-hour consultation that can be done. But what that does is it tells you whether you legitimately have something to worry about or not. Right? Not all cancers are genetically predisposed. The ones that tend to be are breast, ovarian, uterine, prostate, and colorectal. Right? So if you've had your aunt or uncle far removed who might have had cancer, you may not be in the risk bucket at all. So it's very important to understand where this person is and how they are connected to you. And you need to have a pedigree analysis done to really determine the risk. So without that, my suggestion to you is don't get too worried. Right? It is doable, it is manageable, but you need to speak to the right people, and you can connect with Alive, and they will connect with us, and we can set up whatever you need to try and sort this out as well. But it is very easily manageable. I think that's what I want you to remember, and not to worry too much about it. And until you have absolute proof, there's no point in you fretting about this particular thing. Anything else, Kusha? Otherwise, I'll move on to the PSC.
Radiation that we have.
Okay, I think there was one more question which said, is regular exposure to mammography and the radiation that the mammography machine actually gives out harmful or not? Now, this is a really good question, right? So some of the science guys in here I'm going to give you the very nice technical answer. So it says statistically, the risk of having a mammo is less. What does it mean? You have more benefit of getting a mammo done and identifying breast lumps than not getting it done. Yes, it is a low dose X-ray. Yes, you will be accustomed to it, or rather you will be subject to X-ray. And again, that's one of the reasons why we don't recommend women less than 40 to get it. Right? So why expose yourself to the radiation that you're trying to prevent anyway? We don't need to get you into that screening program until you really have to do it. So there is a small amount of radiation, but the amount of radiation is much lesser than what you would actually have over a period of time from your own environment. So in that sense, the benefits of the mammogram far exceed the drawbacks of having that radiation exposure. So simple answer, go get your mammos done. Right? It's okay. You'll be fine. That's what it fundamentally means.
One other question before we
Kusha, we can do the Q&A, and I'll just end it with the breast self exam. That's also fine. I mean, if people are already asking, I'm happy to go through.
So the other question, what is the ideal BMI for a middle-aged woman aged 56?
Oh, we would. So first of all, age has nothing to do with it. They are quite ruthless, right? It's really mean the way they come up and say 18.5 to 25. So what you really have to do, so if you can just even open up a BMI calculator, it's fairly simple. Your weight in kilograms divided by your height in meters, the whole square, right? Kg per meter square. That's how we measure it. If you are 18.5, I will be worried, because less than 18.5, you are malnourished now. Right? More than 25, you are considered overweight. Now, more than 30, you are obese. So there is no way we are talking about going below 18.5 or going above 25. Ideally, for most healthy individuals, we talk about having a BMI of 22 to 23. Right? So if you can get to the 22, 23 range, you're doing really well. If you happen to be, slightly much more athletic in build, a little slimmer figure, and, you can eat what you want, but if you don't really retain that weight, then, congratulations, fantastic. But don't push yourself beyond what you naturally can do, right? There is nothing called size 0. People frown upon size 0, so don't even go that far. But make sure if you are between 22, 23 is perfect. If you naturally are slimmer, you probably might be around the 21, 22 range. That's absolutely fine as well. If you tend to be someone who, like me, stresses, and if I stress, I'm probably going to eat when I stress too, right? So I might sometimes end up at the 23, 24 range. That's fine, but do not cross 25, ladies and gentlemen. You have to control. It's okay if there is a time when, now is a perfect time, right? Diwali is around the corner, and everyone's houses are going to be inundated with something or the other. It's the festival season, gifting is happening, and you enjoy, you're going to be with family. So it's all good. But when you do that, make sure you also give yourself time to come back. Enjoy yourself, take your time, do what you need. You all work hard, so you need that break. But try to come back. Clinically, no, you should not exceed 25 at all, but we always recommend 22 to 23 is a BMI where you should stay put.
Two other questions.
Sure.
If I have a family history of breast cancer, what precautions should I take?
Okay, so again, like we talked about, for family history, again, two-pronged approach. One, please make sure you start reducing your risk, i.e. you will have to look at your lifestyle, right? You are not, even if your risk is very low, if it is complemented by bad lifestyle, even if you don't have a risk, your chances of breast cancer increase. Right? So please be very, very careful that you don't do that. You've got to take a look at your lifestyle and try and get that into control. Again, like we said, the fat content, whether it is through alcohol, whether it is through food, even cigarette smoke for that matter, will increase your probability of possibly getting it. But for you, if you believe you are at risk, one, you need to confirm and verify that you are in fact at risk. Right? We need to sit down and have a chat to find out in which part of the family do you actually believe breast cancer or ovarian cancer has come up. Is this individual related to you in any way? If this is an aunt through marriage, then no, that is not genetically connected, right? So you have to find out exactly how this connection has formed, and based on that, it's only after a pedigree analysis which we will be able to determine the quantity of risk. You could also go the genetic testing route and say, listen, I'll bypass, I really don't know much about my family history. That is also an option you could take to say, what is my personal risk of getting breast cancer altogether? There are ways and there are options, but you need to start reaching out to an expert at this stage. I think if you do not go through the right route, unfortunately, you will increase your stress levels and you'll be worried about something that you can't, control much unless you have the right guidance. So my suggestion would be reach out. You can reach out to Alive, you can reach out to so many other groups where they actually talk about getting a pedigree analysis done. That is the best way you will find out whether you have family history or not.
Thanks.
Please.
Yeah, there was just a related question to family history. If the grandmother also comes, is also a degree 2 relation.
When you say grandmother, is the individual talking about their grandmother? Yeah, if you talk about your grandmother, then yes, that tends to be a second degree relative. Your mother will be a first degree relative.
It was my question. Am I
Hi,
audible?
Apurva.
Hello. In my family, both my my paternal grandmother, mother of my father, and my aunt, sister of my father.
Okay.
One of them had ovarian cancer and one of them had breast cancer. So that makes me more, chances of getting it.
So there is, if it is a paternal grandmother, Apurva, or a paternal aunt, your chances are a little less than had the gene come from the mother's side, but the risk is still there. So you will have to actually do a pedigree analysis to try and find out. So what we'll have to map is, do you have all the details, Apurva, of exactly when it happened, and is it confirmed that it was in fact ovarian and breast?
Yeah, I was grown up enough to know.
Understand? Yeah.
Yeah. So I'm 100% sure about that.
Okay. Yeah, so there is, like I said, when the gene comes from the mother's side, it's a lot more prominent, Apurva, than when it comes from the father's side. So there's a little bit of reduction there. But having said that, given it is a direct relation still, this will be counted as, possibly being in the risky bucket. So here is where we would normally talk about either reaching out now to a geneticist, or if you want to directly go talk to an oncologist, this also can be done. But this will be the primary suggestion is for you to start getting into a earlier screening program, Apurva. And again, what screening, how much? My suggestion is, don't just take these suggestions, because if you've identified as being in a risk bucket, then you'll have to go and speak to somebody, mainly an oncologist, before you can determine what sort of tests and in what frequency we need you to do. Right? Again, it depends on your age that you are currently at, whether it should just be wait and watch. It's only normally when you cross 30 to 35 that we start talking about this. So then again, we don't push everybody into early breast screening, but like I said, this will have to be dealt with on a case-by-case basis. So an oncologist consultation or a geneticist consultation would be important at this stage, Apurva.
Okay, thank you so much.
Most welcome.
Has not going through a pregnancy or breastfeeding have any impact on one's chances to get breast cancer?
Oh, that's a very interesting one. So someone claimed, look, if you don't go through pregnancy or if you don't go through breastfeeding, does it increase your chance of breast cancer? Now, it is a very tricky question to ask, but statistically the answer is yes. I'll tell you why. As we talked about, breast cancer fundamentally means that you are subject to an excess of estrogen in the body, and anything that relates to excess estrogen will lead to breast cancer at times. Now, what happens, as I explained in your menstrual cycle, in the first half your estrogen goes up, and in the second half your progesterone goes up. This up and down also leads to expansion and contraction of cells, which leads to your breast tenderness, breast pain, but is also an irritant for cells, which this is nothing, you can't do anything about this. This is a very natural process, but this constant expansion and contraction could also lead to mutation of breast cells, which eventually could lead to breast cancer as well. So all us women go through this process. If you are in your menstrual cycle, we go through this every month, and there's nothing you can do about it. But it is statistically proven that if you plan your first child in your early 30s, late 20s to early 30s, and if you breastfeed as well, you statistically reduce your chance of getting breast cancer. Why? When you are pregnant, you don't menstruate, right? You do not have your period. So those 9 months when you're conceiving, when you have the baby and when you're pregnant, you don't go through this expansion contraction. Now, the body also has an indication that if you start breastfeeding, your periods don't start. Your periods are delayed if you breastfeed. So if you can breastfeed for 6 months, so 6 months of breastfeeding plus 1 year of the 9 months of pregnancy, right? So the 15-month gap that you are actually giving does create a nice break for the body. Those cells don't expand and contract so much. So statistically, yes, women who have decided to to conceive, to have a child and breastfeed, your risk of breast cancer reduces. Now, for those of you who do not want to go that route, and that's personally your choice, but that does not mean that, that will lead to breast cancer. Again, if that is your choice and the risk might be a little higher, very, very marginally so, you will have to make sure you put yourself through a screening program much faster, right? You're going to watch out for those things. But yes, statistically, over a very large sample set, and this is proven in every country that has done this particular study, pregnancy and breastfeeding does reduce the risk of breast cancer.
I have a question. Am I audible?
Yes.
Okay. My sister had ovarian and gastric cancer, and she just passed away last year.
I'm so sorry.
I have a little doubt, like, will I be getting the same? Should I take any test for that? And how to identify that?
Sure. I think when it comes to gastric cancer, the chances that it might be hereditary are a little lower, but the fact that you mentioned ovarian, and given she is your sister, yes, the chance is, there is a risk involved here as well. So here again, what I would suggest is the most important thing is start getting an oncology consultation. I think if this was relative several degrees removed, I would have still said you can speak to a geneticist, but getting an oncology consultation and starting your screening early is the best thing we can do. I think what I want to try and put out the message there is we all have some level of risk. And even those who don't have family history have some level of risk. It might be through lifestyle, it might be through pedigree, it doesn't matter. But there is no option for us but to start moderating our lifestyle and, more importantly, getting screened. You've got to go actively look out for these things. It does not mean you will get breast cancer or ovarian cancer in your lifetime. You could be one of those lucky ones who just goes through and nothing happens. But in the off chance that, you or I are not so lucky, then getting the screening done is most important. So I think given it was your sister, my suggestion would be an oncology consultation would be important. And just to have that chat openly, just like you're having here, I'm sure you have more questions as well. I think having a proper consultation would be essential.
And should I carry my sister's report as well for my testing? Is it mandatory, my sister's report?
I think you can use that, but what will be more important is your report. So if say for example, you are above 40 and you do start getting your mammos done, or if you are very keen, you want to do a genetic test done and go straight to it because there is family history here, then your reports become more important. You could have two siblings with very similar genetic makeup, but you might act very differently. So your sister's reports can be helpful, but they will not be the defining factor that will determine how you progress. So yes, you can certainly do that. If you happen to have any tissue samples, that is biopsy samples from her treatment, that also can be helpful. But like I said, we would rather speak to the proband. Proband is the person we are talking about, right? We'd rather do the testing for the proband than do the testing for the relatives. So I think you can take it into your consultation. Please take your sister's reports, anything else you might have. But what you will realize is they're going to ask that you can start getting some of your tests done. And I think that's more relevant anyway. We are talking about you and your health. So that will take priority. But understanding the type of cancer that was in the family would also be helpful. But it will not be the defining factor to decide your risk per se.
Oh, thank you.
So there are a few questions that have come up in the meanwhile.
Sure,
One is,
sure.
the question which was about pregnancy and breastfeeding. Is there any impact of having an abortion on your chances of getting breast cancer?
No, not at all. And miscarriages, abortions are very, very common, right? So what we're talking about is the fact that giving the hormones a little bit of reprieve, right? And that is also, it is very common to have miscarriages these days. That does not affect your chance of getting cancer in any way. Another very common question while I'm at it is people talk about PCOD and say, listen, if I have PCOD, am I at risk of getting breast cancer? Absolutely not. Very common female conditions. You do not have to be worried about them. What you do need to do is start talking regularly to your gynec, because these things are going to worry. You're going to keep thinking about them. So getting to that gynec, speaking to them, that is what's more important. If there was a miscarriage, you might want to understand why that happened in the first place, right? But no, it does not link to the risk of getting cancer. It's somewhere in your lifetime if you have a pregnancy and you choose to breastfeed, and that definitely is beneficial both for mother and child in many, many ways. So that's all we're talking about. It's a lifetime thing. It doesn't mean that any kind of miscarriages or abortions will increase your risk of cancer at all.
Got it. Thanks, Sonali. Sonali, the other question was, when you go for clinical exam and they detect small lumps and suggest a biopsy, should we consult with the gynec first or should directly go in for a biopsy?
So I think here's the point, right? Anytime you identify a breast lump, the question is, what is that lump? Is it a cyst? Is it a fibroadenoma? Is it actually a malignant lump? You don't know. So you will have to do the biopsy. Right? So there is no option. Now, if you don't, and nobody will, right? You won't jump at the idea of biopsy and say, yes, let's get it done. You might want to go back, consult your family GP, speak to somebody, get a little assurance and say, hey, listen, what am I getting myself into? What is this process going to be like? Is it be painful? Is it going to be awkward? Is it going to be tough? What is it? But the fact remains, you need to know what that lump is. And you need to identify what that lump is. Now, I had a fibroadenoma, which was also surgically removed, but I can't just through palpation figure out what that lump is going to be. Right? So you have to go through the biopsy. You can take your time. You can get your head around it. You can feel comfortable with the idea and then go ahead. No one's saying if you don't do it right away. And I think that's another little bit of advice. Sometimes doctors can, in their enthusiasm, be very persuasive and say, Abhi kara lo, do it right now, or something would happen. Come back to the same doctor if you will, but you do have time. Go back, think about it a little bit. Get your head around it, understand why you need to do it, then come and do it. So there's no rush. But then again, I would say, please don't wait for months, right? When I'm saying no rush, a week to 10 days is fine. Think about it. The lump is not going to grow massively within a few weeks. But if you wait for a few months, then yes, the lump might grow and you might have missed a chance to get it done early. But if someone says right now, hey, I can feel it, get it done. If you're not comfortable, take time, no problem. That's your right. You can take time, feel okay about it, go think about it, discuss, Google, research, whatever you want, and then come back. But don't give it too long. But if it's a lump, we do need to know what that lump is.
Thanks, Sonali. Sonali, the other question is it recommended that if two individuals come from families that have experienced cancer, they should not try to conceive?
No, not at all. Absolutely not at all. So, for example, if you had someone with a risk of breast and ovarian cancer, then the very fact that pregnancy reduces your risk, right, would There is nothing that basically talks about the fact that if you have a history of cancer, you should not conceive. Look, when you do conceive, and if you consult with your gynec, if you're planning for your child, make sure you understand what genetic conditions you could pass on to the child. There are other, prenatal conditions that might pass on, right? So if you have Down syndrome, if you have other genetic conditions, those are the things you should be having discussion with, but cancer is not one of them. And we've even had individuals who very, very unfortunately were diagnosed with cancer during their pregnancy. Luckily, it was in the later stage. They, they had their delivery, baby born, and then underwent treatment as well. So unlike HIV, cancer does not pass. There is no data to show that cancer actually passes from mother to child during pregnancy. It doesn't go there. So even if the mother has cancer during conception, the child is fairly well protected. The maximum we've ever seen is it might have entered the placenta a little bit, but the child has never had it because the mother has had it. So no, that is not at all required. You do not have to not conceive. You can have a very, very normal, healthy life. Look, and the point I want to make here is we're all assuming we know what happened to our family members. There is so much that we don't know about the past. Some of us may not even know what our grandparents went through. So that doesn't mean you don't get on with your life. The idea of this is to take charge and figure out what you should be worried about and what you should just let be. So it's not, certainly not. I mean, you can go ahead and have a very, very healthy lifestyle. In fact, we've known even people with pediatric cancers who've gone on, got married, had children, and are living very, very well now. So even cancer patients can conceive. There is nothing like that.
Thanks, Sonali.
Sonali, Apurva, this side.
Hi, Apurva.
Yeah, I have one more question. We had a question regarding abortion sometime before. So, sometime what happens is that the female is having a weak pregnancy. In the initial stage, a lot of progesterone in terms of injections and tablets are given. Does it, and the female she miscarriages, and the pregnancy does not go successful. Does this extra progesterone that has been injected to the female, it affects in any way?
So, Apurva, right now the jury is still out. So, like you mentioned, if you go through in vitro, if you go through IVF, or on the flip side, actually, if you talk about hormone replacement therapy post-menopause or towards menopause, both require estrogen and progesterone to be provided into the body, right? And that is what you're trying to balance out. But we do not have enough evidence right now, Apurva, to say whether this is definitely cancer causing or not. Now, IVF has been very successful in the past. Hormone replacement therapy has also been quite successful for many, many women who have had, anything from, night sweats, massive mood swings. It has really helped stabilize a lot of women going through menopause. So hormone replacement therapy, hormone infusions during IVF, there isn't enough evidence to say that they definitely lead or don't lead to. What happens is anytime you start taking hormones, whether internally or externally, you just need to be in a habit of constantly connecting with your gynec. Even for that matter, if you want to go through, if you are doing family planning, again here there's a hormone induction that we talk about. Even here, you need to be in constant touch with your gynec, and your gynec will regulate the amount of hormones that you need to take at each time. Some people tend to say, hey, listen, this particular combination works really well for me, I'm going to stick with it. My point is, you can't be the judge. Make sure you're constantly in touch with your gynec to understand this. But there is no clear clinical evidence to say that if you have hormones being introduced, it is directly related to cancer. Yes, statistically the risk might increase, but there isn't enough evidence to say exactly what causes it. So that doesn't mean you should not do IVF or you should not do hormone replacement therapy. There is a connection, there's a correlation, but exactly how much, we're still figuring out. So the best option is if you are going through IVF, if you are going through hormone replacement therapy, make sure your gynec is completely in touch, your obstetrician is fully in the know of what you're planning and what you're doing, and consult with them regularly. But no, you don't have to worry about not getting on